Today I wanted to share my experience with bleeding during pregnancy. So I have had two babies. First one, pregnancy absolutely smooth sailing. I had like mild symptoms, I would say, no issues, baby fine, I was fine. So when I got pregnant again, that is what I expected. I literally expected to have the exact same pregnancy. I think I found out I was pregnant when I was about 4 weeks with my second pregnancy, and at that point obviously you don't really get symptoms. I was sort of waiting for them to kick in. We'd booked a holiday typically before I found out, so we were due to go away when I was 8 weeks. I thought, great, I'm going to be feeling like horrendous on the plane, on holiday. Didn't really, I felt fine, absolutely fine. I have to say I was a bit off food. Certain foods made me feel a little bit funny, but not really. With my first pregnancy, I wasn't actually sick at all, but I felt like really ill a lot. But yeah, I didn't really feel that. So I got to about 11 weeks. Lou had been away for the weekend, but thankfully he'd got back that evening. I think he got back about 6:30, and it was 8 o'clock. I went outside to bring some washing in, and suddenly I just felt really wet. So I was like, oh God, went to the toilet, lots of blood. Obviously, immediately think the worst. In my head, I'd had a miscarriage because that's all I thought bleeding in pregnancy could be. So we rang the triage line and they said, because of the time and it's a Sunday, chances are nothing is really going to be able to happen today. So she said you can choose to wait till tomorrow, call up and they'll get you a scan, or you can go to A&E now and you may get one, but you might not. So we chose to go to A&E just because I felt like if there was a chance I could get some peace of mind, I wanted it. So we went down there, and obviously A&E, you sit there and you wait and wait and wait. We were in and out a couple of times. So the first time I think they did my blood pressure and stuff like that. And that nurse said to me, we can't rule out that you are having a miscarriage. She said you could be, but equally you can bleed and not have a miscarriage, so she said don't lose all hope yet. He came back out, went back in again, and they did a urine sample. And she said to me, the urine is still saying that you are pregnant, but she said it could still be an early miscarriage. It's perhaps just you've still got enough of the hormone to suggest that you are pregnant. She said, I would love to be able to give you a scan today, but unfortunately it's not going to happen. Because by this point it was about 10 o'clock on a Sunday night. So she said, your best bet is to call up tomorrow. They'll book you in for a scan as soon as they can, and then they'll check the baby. So we did that. So obviously went home. When I was in hospital, I was still getting quite a bit more blood, so I had like pads and stuff in. But by the time I got home, and sort of definitely the next day, it basically stopped. So then I started to get a bit of hope, which at the time I was like, I shouldn't get hope, because if it is a miscarriage, then, you know, I'm just working myself up to feel worse. So we rang on the Monday and they'd booked us in for a scan on the Tuesday morning, which a whole day of like waiting to know what's happening was absolute torture. So I literally just like worked from home. I literally was sat in bed, I think. Went into the scan the next day. Nervous, obviously. First thing they said, thankfully, was the baby's okay. I can see there's a heartbeat. So from that point, absolute relief. Like, couldn't believe it, to be honest, because in my head I really was certain that we'd had a miscarriage. And she said, right, so now we know baby's okay, let's try and see what's causing you bleeding. So she had a look round and she said, right, I can see that you've got a subchorionic hematoma, which I was like, what is that? Like, what is that? She said, it's, the way she described it to us, it's like if you get like kicked in the leg and you get a really deep purpley bruise. She said it's like that inside. So that's where the bleeding comes from. It's like the blood sort of draining away, because it was quite dark blood. And I was like, right, okay, so what does that mean? So she said where it's positioned, you're probably okay, but they have to be careful, because if they're positioned sort of near where the baby is implanted, it can cause it to break away. So it can cause miscarriage. But she said, looking at yours, you should be okay. So, you know, I came home. At this point, we were like 11 weeks. So I think we had our 12-week scan the week after. So I came home and was like Googling it non-stop. Like, what does this mean? How am I going to carry to full term? Blah, blah, blah. You know, like, because at the time I was just so relieved to hear that the baby was okay. And then when I came out, it was like so many questions that I wish I'd asked and I hadn't. And Thankfully, we did not have long to wait till our 12-week scan. So by the time, you know, we'd had that scan, my bleeding had stopped. And in my head, that was going to be it then. No more, nothing else, fine pregnancy. Went to the 12-week scan, and it had changed shape a bit. She said it had sort of like lengthened out a little bit, but it was still okay in like the position it was in. I expected it to be like, all right, you've got this, but she didn't really seem that bothered. So I was like, oh, okay. But, you know, the 12-week scan, everything was fine. The baby was absolutely fine. Everything was normal. So that time, the first time I bled was the 5th of June. And then we got to the 12th of July. So quite a while after, went to bed, got up to go for a wee, as you do at this very annoying stage of pregnancy. I think I'd been in bed for about an hour. And I felt really wet again. So I went to the toilet. Honestly, I did think I'd wet myself on this occasion because I really needed a wee, and I sat up and I'm thinking, oh God. But it was blood again, really bright red, fresh blood this time as well, a lot of it. So this was 11 o'clock at night, so my poor sister had to come round again and be with Emmy that late. So we went in, so we rang the triage line, they told us to go straight to the maternity ward at the hospital. Obviously because it was late, they wouldn't have had the daylight triage area open, so we had to go there. And obviously now, because we were a little bit further along, so I think I was about 16 weeks, they could hear the heartbeat now, like with the Doppler thing. So she did that, and obviously it was fine again. She said to us, it's very common to bleed in pregnancy. She said we get about 5 or 6 women a day coming in with bleeding to get checked, which absolutely blew my mind because I honestly have never heard anybody else have this. Only people I know that have bled have miscarried, so it was quite a shock actually, but also gave me a bit of reassurance. And she said to me, we can check your cervix if you like, but it's up to you. And we sort of said, well, you know, we've heard the heartbeat, so let's just leave it at that for now. And she said, I will expect to see you again. She said it's quite common that if you've bled once, you'll do it again. I was like, great. She couldn't say what it was. She couldn't say if it was the same as the first time. The only thing I would say is it was different blood this time. Like the first time was quite darkish, whereas this time it was very fresh. So that was the 12th of July. We went to Weymouth that weekend, and it happened again, another gush, and then it sort of, that's it. That's what I had the first time, it was a gush, and then it stopped. So I don't know what it was, you know, it was really starting to get to me, put me down, because even though I knew the baby was okay, still worries. I was worrying that something was wrong with me. What if there's something wrong with the baby, like when it comes out? You question everything. And they did say to me when I was in the hospital, you should come in and get checked every time, but I think because we were away and we'd just been like a couple of days before, I just thought, let's just, you know, unless I get it again, we'll just say I'm okay this time. Then, you know, weekend in Weymouth, we came back home. I think I've been home, I don't know, 2 or 3 days, and it happened again. Another gush of fresh blood, this time right in the middle of the night again, like 2 o'clock in the morning, so I was not about to go into hospital at that time. We went in the next day, rang up the next day and went in. Went to the day triage area this time, so you know, they've obviously got my notes of what's happened. So the doctor said, because this has happened to you now quite a few times, let's look at your cervix. So I was like, right, okay. So I have had quite a lot of smear tests over the years, and this was the most uncomfortable pain in the world. I remember squeezing Lou's hand so hard, and I don't know if it's because I was pregnant or just the way this doctor was doing it, but I was literally like, whoa. And so she had a look, and she said, you've got cervical atropion. I think that's how you say it, which is where the cells from inside of your cervix have sort of come onto the outside, which apparently is very common if you've had a baby. And she did tell me that on my last smear, and she said it looks very irritated. So she said it could be that's caused you to bleed, but she didn't know. She couldn't tell me. She couldn't tell me if it was related to the hematoma. She couldn't tell me what it was. So I was a bit like, right. She said all you can do is just have reassurance that every time you've come to get checked, the baby's okay, and just keep doing that every time. She said, I can't say what's causing it. She said, often if you bleed quite a bit in pregnancy, it can cause you to come early. She said it is quite linked to that, but she said I can't confirm anything, so I was a bit like in the dark. And I would say, like, this bleeding, I remember saying to my sister, like, if I come out of this pregnancy, I'm alive and the baby's okay and everything's fine, it will be a miracle. Because at this point I was just feeling so low about it all. Like, it was just such a worry. And I was on edge every time I went to the toilet because I was worried I was going to bleed again. So after that time, so that was like a gush again, on the odd occasion for maybe, I'd say a month after that, I'd get the tiniest spits of blood spotting. But at this point, I was obviously having quite regular appointments with my midwife. And my midwife was great, actually, because with your second pregnancy, you obviously lose a lot of those midwife appointments that you would have had with the first one. But she said to me, I don't get why we do that. I'm never going to stop you from coming. So if you want to have all the additional appointments that you would have had the first time round, let's do it. I think I would have said no if everything had been okay, but because of my bleeding, I was like, yes, please, because I just wanted her to hear the baby every time. So I was going quite regularly. Because I'd bled and had this hematoma, I had to go to a consultant anyway because of my tears with my first labour. She'd booked me in for growth scans because she said if the bleeding is related to your placenta, which it can be, we need to keep an eye on it. So she'd booked me in for like loads of additional scans, which I was going like once every 4 weeks from about 18 weeks, I think, which was great. So obviously we had our 20-week scan as well, and then all these additional ones afterwards. So on my 20-week scan, where they check where your placenta is, it was under 2 centimetres just away from my cervix. And the sonographer had said to me, if it is a lot less than 2 centimetres, she said, if it's less than 2 centimetres away from your cervix, you have to have it checked again, because obviously it can't be in the way when you have the baby. But because I was having the growth scans anyway, it didn't really matter because they would have been checking it. So I kept thinking, like, maybe that's why I was bleeding. Like, maybe my placenta was there, because it can still move at this point. Maybe it's moved a bit, and maybe that's why I was bleeding at the start. So as I was having these growth scans, by the time it got to the stage where it couldn't really move anymore, it had gone quite far away, and I wasn't bleeding anymore. I'd stopped bleeding by maybe about 23 weeks or so. And from then, it started to feel like a much more normal pregnancy. I still didn't really get any symptoms at all, didn't really feel sick, which grateful for, because obviously at the time I thought there's something wrong, and then bleeding, something wrong, but actually nothing was wrong. And we ended up having, a very perfect labour. I've just uploaded my labour story for this one, so go and watch that. And actually what I asked for, if I'm okay, if the baby's okay, was actually what happened. So the reason I wanted to upload this is because I know how worried I was during that whole thing, and didn't really find an awful lot of things that would reassure me, like stories of other people. So just to give anyone who needs it some hope, that doesn't necessarily mean anything's going to go wrong, because mine has been okay. I bled quite a bit, all different kinds of blood, and baby boy is now here. He's asleep at the moment. He's fine. I was fine. So far my body is okay. So, he's 6 months old now, so I'm sure something would have come of it by now. So yeah, I wanted to just share my experience with it all, and hopefully it helps somebody feel a little bit better. I feel like I've rambled a little bit because it's a bit all over the place in my head. So, if anything's not clear or anyone's got any questions, please ask and I'll do my best to answer. But yes, thank you for watching, and I shall see you in the next video.